Hello, everybody. My name is Catherine. I'm going to be presenting about Lassa. So, Lassa is a um, so these are our objectives for today. So we're going to go what it is, the infectious window, who is most susceptible, why is it important for us to know about, and how to prevent the spread, and where to get tested. So, Lassa is a viral hemorrhagic fever illness that is spread through infected rats. The rats that carry this particular virus are the mastomy rats, and they live in countries in Africa. Basically, it damages your blood vessels and lowers your blood's ability to clot, causing uncontrollable bleeding. Um, the infection is typically by from rats, but can be also human to human transfer. And usually symptoms are mild, but in 1 in 5 cases, it can be quite severe, leading to uncontrollable bleeding. So the infectious window for Lassa is 2 to 21 days. It's spread by coming in contact with rat poop or urine, and it can be spread human to human, but as I said earlier, that's less common. So who is most susceptible? People living in West Africa and pregnant people. Some West African countries that are known to have Lassa in them are Nigeria, Benin, Guinea, Liberia, Mali, and Sierra Leone. You can see on the slide that there is a picture of Africa and the areas in which um, there are endemics. Or in blue, yeah. So why is it important for us to know about Lassa? So in 80% of patients, it's actually asymptomatic. So they're carriers for it, they're spreading it, and they don't even realize that they're doing it. Um, in 1 in 5 cases, though, the condition can really progress, and that leads to people having uncontrollable bleeding and possibly death. Um, in pregnant patients or pregnant people, there is a higher case of higher of maternal and fetal mortality rates. For fetal mortality rates, it's 80% if you're infected with Lassa and 30% for maternal mortality rates. In terms of treatment options for Lassa once infected, they're quite limited. It's really just managing fluid management. So they give a lot of fluids to make up for the blood loss that's occurring. There is no vaccination available, and there's also no medication available. So really, the option is just to keep people hydrated. So, how do we prevent the spread? Um, the main way is to reduce rodent to human transmission. So that can be done with just good community hygiene. So making sure that your trash is protected and that you don't have a rat infestation can really lower the risk of Lassa. Um, reducing the risk of transmission to healthcare providers. So the utilization of um, personal protective equipment, such as masks or gowns, can be effective. Early detection of the disease. So, identifying people or areas that are suffering from Lassa uh, um, endemics can help to lower the spread from one person to another, from rodents to another, to people, um, and avoiding like becoming in contact with bodily fluids from people who are sick. And then the final thing that we can do to help prevent the spread is to check travelers for the disease. So screening travelers coming from endemic areas can also help reduce the spread. So where can people get tested? You can get screened at airports for the disease, or you can also get screened at a hospital for the disease. And that concludes my presentation. Please let me know if you have any questions. And then the final page is just my references. Thank you so much for attending my presentation today. I really appreciate it.